During a carotid ultrasound investigation, you will need to measure the peak systolic and end diastolic velocities from the pulse Doppler waveforms. These will be used to grade the severity of any hemodynamically significant internal carotid artery disease, so it's really important that these measurements are as accurate as possible. The key error in velocity measurements is having an incorrect Doppler angle. In this Med Mastery lesson, we will look at why it is so important for the pulse Doppler angle to be 60 degrees or less. When making velocity measurements, you'll be using the pulse Doppler. The B mode and colour flow should also be used to help determine the direction of flow. To set up the pulse Doppler, the angle correction cursor is used to get an accurate estimate of the angle between the pulse Doppler beam and the direction of flow. As you rotate the angle correction cursor, the Doppler angle will be shown on the ultrasound screen. The angle correction cursor should be aligned to the direction of flow, as shown here. Once the angle is known, the signals can be processed using the Doppler equation to calculate velocities. It is important to keep this angle at 60 degrees or less. As you can see here, the potential for errors in the calculated velocities increases significantly for angles above 60 degrees. To create a good Doppler angle, the B mode and colour flow images should be used to help align the angle correction cursor to the direction of flow, which is usually shown going from right to left in the carotid ultrasound image. Typically, this means aligning the cursor to be parallel to the vessel walls as you move through the vessel. However, where there is a tight stenosis created by a plaque, the jet flow in the remaining lumen may not be parallel to the vessel walls. In this case, it is important to align the angle correct cursor parallel to the jet rather than to the vessel walls. The pulse Doppler beam can be steered to help with this. You can also use the heel and toe method to rock the probe on the patient's neck by pushing very gently at one end to create a better Doppler angle. In most circumstances, you'll be able to create a Doppler angle of exactly 60 degrees using the pulse Doppler steer control or by adjusting the probe on the patient's neck. However, when this isn't possible, it is recommended that the angle is kept between 45 and 60 degrees to ensure that any errors due to the angle are kept small and consistent. Using an angle of greater than 60 degrees isn't acceptable, as the errors in the velocity calculations will be too large.